Well, hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
Great, and yourself?
I'm living it up. I'm always living it up. You know that.
Excellent. I love that answer. Well, we have some exciting things to discuss today because with our listeners' calls at 866-870-5752, we hope to be able to have Dr. Darrow solve your chronic musculoskeletal pain issues. So what
What
does
about
that
the
mean?
acute? How about the acute,
There could
Nita?
be some acute too. There could.
What is the difference? Let's quiz Nita.
Okay, the difference is chronic pain is considered 3 months or 90 days or more of in the duration of how long you've had your pain. And acute pain, it could have happened 10 minutes ago
Yeah,
or
acute
more
just
recently.
means acute means new, chronic means old. That's simple.
Oh,
Most
okay.
people
I
come in
like
the
that.
office and they go, "I'm in acute pain." How long have you had it for? 20 years. So it's a chronicity. It's a timing thing that people don't understand. They think acute means terrible, but it has nothing to do with the intensity.
So the key is that if you have intense pain, that's another conversation. That's
That's
different.
true.
Different adjectives.
We take care of that too.
Okay, and we take care, or you take care of muscle pain, joint pain, tendon pain, ligament pain, back pain, neck pain, knee pain, hip pain, arthritis pain, and so much more. Just trying to give you an idea of the area of the body we're talking about. And you can call us starting right now. I have lines open for you at 866-870-5752. And you also will get a free book when you call the program. It's Dr. Darrow's latest. It is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with lots of scientific studies in that book. You want to get that. The other thing you can do is go to the website, which is www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site, and you can also watch him performing the treatments on videos. Lots of cool stuff, yes?
Yeah, we're recording the show right now. For those of you that want to go to the website, you can watch a lot of our shows there, and you'll get to see me sitting in my golf outfit ready to go.
Yay! And with your baseball cap on.
That's right.
Okay. So let's give the phone number again, 866-870-5752. That's a number for you to call us right here, right now. And in the meantime, do you want to take an email?
Yeah, I've got endless questions as people know who email me. Um, Whoa, there's a guitar playing.
That's
Yeah, I
nice.
do. I
Is
do
that you? Do
love
you
to.
play?
I do play guitar
Oh,
and
I didn't
banjo,
know
mandolin.
that.
I just got
Banjo I knew.
into Yeah, I just got into lap steel and dobro, so I'm going to be actually taking a lesson on that later today. So yeah, I love music. I've been playing since the '60s, and I'm only 16 years old. So try to figure that one out.
Wow. That's totally
But anyway,
awesome.
let me
Magic.
get to a question. By the way, for you folks that cannot call in for some reason, I hope you do call because it makes the show really interesting. But for those of you that don't want to call in, if you want to just email me, you can go to my website. Nita mentioned it. It's www.lastemcells.com. That's lastemcells.com. And on every single page, there's a spot where you can email me. And I get back to every email every day. And I get so many, you can't believe it. I'm usually up till midnight doing emails. And I start the morning off doing emails. In between patients, I'm answering emails. So it's something I do as a service to people. And if you have questions, you can do it that way. Or you can just call me right now. I'd love if you called me now. The number to the studio is 866-870-5752. I'll repeat that at KRLA where we are. It's 866-870-5752. Please call if it's not about you, if it's about a parent or a friend. That's fine. It doesn't matter. Anything about musculoskeletal pain, I don't deal with different diseases. I don't deal with musculosclerosis or vision defects. I get a lot of questions about that, whether stem cells can help people with that. But that's not my line of work. My line of work is orthopedics without the surgery. We do it by regrowing tissue, and it's a great way to heal people, because why cut the body open and have all the possible problems and sequelae of infections and problems like that, when you can just get an injection? You just walk into the office, get an injection, and walk out. It's really a very simple process of doing PRP, which is platelet-rich plasma. We just draw your blood, we spin it in a centrifuge, and then we take the platelets and inject them. Or we can take that and mix it with umbilical cord stem cells. And we've got a huge study right now going on, hopefully be published by the end of the year, with about 2,000 people, showing that whether we use bone marrow, which I've done thousands of cases of that, where we drill into the pelvis, take out the bone marrow, which has both platelets and stem cells, or if we use platelets mixed with umbilical cord stem cells where you don't have to get drilled. So that's what people are choosing today mostly. The results are the same. So there's no reason to be drilling. I know there's other doctors around the country, around the world, that disagree with me. And this is, although I've been doing this work for over 20 years, it's still, there isn't that much research on it. There's a lot, and there's more every day. But we don't have standards yet. The FDA, in about a year and a half, will have standards of what we're doing. But until November of 2020, it's sort of what they call the wild, wild west. There's some doctors that think only bone marrow is good. There's some that think umbilical cord stem cells are better because there's more stem cells in it. We don't know the answer, but we do know from my office at least, and we have a 20-person research team, that whether we use bone marrow or whether we use platelets plus umbilical cord stem cells, the results are almost exactly the same statistically. So, Nita mentioned at the beginning of the show that I inject all over the body. I don't really care where it is. I've been doing this for over 20 years, and I've had occasion on my own body, as you listeners know, to inject my elbows, my wrist, my shoulders, my knees. I've had someone else inject my neck and my back a few times. And these procedures of regenerative medicine using stem cells or platelets work everywhere. So it could be your toe, it could be your finger arthritis. It just doesn't matter. Rotator cuff tears in the shoulder, meniscal tears in the knee, low back pain, neck pain. Just about anything on the body I have injected, and I've had amazing, amazing success. It's not going to work on everybody for various reasons. The most common is that people don't come back to finish up their treatment. We do have people that will fly in from all over the world for one treatment, and some of those come back once a year. It's a big trip. Some of them, I had a gentleman from Georgia who flew in for 1 week, and I did 3 stem cell treatments on him. And I just talked to him. He texted me a couple of days ago, and he said that his knee is healed. He had pretty bad arthritis, and he doesn't have any more pain. So it can be done, a couple times in a week, 3 times in a week, but typically I'm going to inject, if someone is local, about once every 2 weeks, give it a chance to heal a little bit, because we are creating a little mini injury. So anyway, back to this question that someone sent in from the website.
And we do have a caller, just so you know.
Okay, well, let's do the caller so they don't have to wait, and then we'll get back to this question.
Okay,
so Palmer, I'm looking at you here, and you've got arthritis and bone spurs in your toes. That's something I deal with every day, and I just did one a few days ago. A person came in, and this actually wasn't the toes, but it's the same. They had midfoot arthritis, and I used an ultrasound. And by the way, for you folks listening, if you're going to get injected, make sure your doctor knows how to use an ultrasound to look inside the body. Because for little joints like the toes and the feet, the knees and the shoulder and the hips, you've got to use an ultrasound or you're going to miss the joint. So is this the first toe that you have this bone spur on? That's the most common in the foot.
Yeah, so both of my big toes, I'm a former Radio City Rockette, been dancing my whole life. And, so the arthritis, definite cartilage loss. I've had the MRI in both toes. And a little bone spur appearing in one of the toes, maybe the others, I can't remember. But the pain, I can't go up on what we call demi-point. The full flexion of the toes is very painful, and I'm still dancing. So,
good for you.
My main question was, because I feel confident stem cells would help with the arthritis, but with a bone spur, is this something that would need to be surgically done, or would I be better trying the stem cell therapy and then... Hello?
Yeah, I'm with you. I'm listening.
Go ahead, Palmer. We're here.
You said, and then...
Wait, I'm
you didn't
sorry.
finish. Let me take it right now, Palmer, because you've given me a lot of information to explain to you. Do you have a bunion on your feet?
Yeah.
Okay.
So
let me talk for a while. Okay. So a lot of people shave those off for what we call cosmesis. They don't like the way it looks or it won't fit in a shoe. But for pain, what we do is we inject that joint with a 30 gauge needle. It's like an acupuncture needle. It's teeny weeny. And we'll use a cold spray to freeze the skin so it doesn't hurt too bad. And we put a person then in a walking boot to stabilize that joint for a few weeks while it's healing. Typically, we're going to inject that once a week or every couple of weeks. And the pain can go away. If you need to get rid of that bone spur for cosmetic reasons, if it's large, this will not get rid of it. So the stem cells oftentimes will get rid of lumps and lesions like that. But if it's a big piece of bone and you've been doing this for 50 years, there's a good chance you will have to have that surgically removed, not for pain reduction or function, but just for the cosmetics of it.
Okay,
so I would have to see that and talk to you and see if, what your goals really are. It's to remove pain, then we can do that without surgery.
Okay, because there's cosmetically not a bunion in terms of what most dancers have. My feet actually look pretty normal, and the bone spur is not visible.
Good. Then you don't need to have surgery for that.
Okay.
The thing about bone spurs that people don't understand is it's not the bone spur that causes the pain. One of the most common things we see in the feet is what's called plantar fasciitis, and that's underneath the heel. And they say my doctor took an x-ray or an MRI and they see a bone spur. Well, it's not the bone spur that's causing the pain. It's the ligament attachment that is not steady or secure or integrated that causes a pulling on that attachment to the bone. And every time it pulls, a little bit of calcium is deposited there. And then that grows over the years into a spur. So, you don't have to cut off spurs. Occasionally you may have to. I mean, I've seen some spurs in a shoulder that were 4 or 5 inches long. And no matter what I would do, that would block the range of motion. So that had to be cut off. It didn't get rid of the pain, but it blocked the range of motion. So I would have to see that part of the body. If you do want to come in and have me check you out, the phone number to the office is 800-300-9300, and we can do an insurance verification immediately while you're waiting on the phone. And we do take Medicare, Cigna, Aetna, Blue Cross, Blue Shield, United Healthcare, and for people without insurance, we take Care Credit. But they may not pay for these procedures. So what you can do is you can just call the office. I'll give out that number again while people are scurrying for their pens and pencils and paper. It's 800-300 9300. So it's 800-300-9300. We do have people by the phone right now to answer your questions and to check out if we take your insurance. Unfortunately, health insurance doesn't pay for most regenerative procedures. Often, if you're in a car accident or have a workers' comp case, it will pay for it. So it's confusing. You have to call the office to find out if we can help you with that. So does that answer your questions?
Yes, it really does. And your office does. I am putting up a fund for this because I realize insurance won't pay for it, most likely. But in your company, your office takes payment plans?
You know what? If you want to call the office to find out information like that, that's the way to do it. We don't really deal with that on the radio. It's confusing, and it's specific to you. Okay?
Fantastic. Thank you so much.
Thank you.
God bless you, Palmer, and thank you for calling in. That's a great question. And so many people are riddled with arthritis in their feet or their fingers or toes, their knees, shoulders, neck, their back. And it is something that in most cases we can help you out with. So, interesting case, a woman came in yesterday and she had been in before for stem cells. And after her first treatment, when she came back, she said she was 50% better. And she told me that when she came in, I told her I couldn't help her. And she begged me to do the treatments anyway. And the reason I told her that was because her arthritis was so advanced that I didn't think I could meet her expectations. And when I don't think I can meet your expectations, I tell you. That doesn't mean the treatments won't work to some extent, but I like to be really straightforward with people. It's their decision whether treated or not my decision. And I find that so many people come in from other doctors, especially surgeons, where they've gotten a lot worse, and they have sat in the chair in my office crying, saying, why didn't the doctor tell me this could make it so much worse? And I don't know the answer to that. I'm very straightforward with people. I make them sign a consent form saying that there are no guarantees in medicine and that terrible things can happen when you go to doctors. So, if you can help it, stay away from doctors. There is a statistic that is ridiculous. The number 1 and 2 cause of death in our country is heart disease and cancer. And no one can believe that the number 3 cause is what we call iatrogenic. That's a word that I'm sure Nita is going to want to learn. And
I know what that means.
Yeah, tell us.
Iatrogenic means caused by the doctor, the medication, the hospital, or somebody in the medical field.
Yeah, or infections after procedures, which is super common. So I actually paid a bunch of money to have St. John's Hospital Infectious Disease Department come to my office and let me know how I was doing, because we have protocols for everything. And the woman who came out, she spent a couple of days watching me and watching our staff, said that we have the cleanest facility that she has ever seen. No hospital and no clinic, she said, is as clean as ours. But, stuff can happen, and people need to know about it. I have a long consent form, and I have a large font. I think I have a 14-point font. And people say, my God, why do you make it so big, and why do you make me read it? Because you need to know when you see a doctor, go to a hospital, that stuff can happen. We don't shove it in front of someone's face with a pen and say, sign it. So people complain about that. They go, I never had to do that before. Well, it's for your own good. I want you to know it doesn't help me. Do you think the judge or the jury cares if you signed a consent? Not really. If something happens, they go after the doctor or the hospital. But I just like you to know before you do a procedure that there are possibilities of things happen. I'm knocking on wood right now on my desk.
Yeah, we hear that.
Happened.
It just echoed all through Radio Land.
Yeah, I've been very fortunate with all that. I've never had an infection or anything. So we take care to take care of you, and I hope you appreciate it.
All right. So our number is 1-866-870-5752. That's 866-870-5752. Check out the website at www.lastemcells.com. That's lastemcells.com. I have lines open for you right now. Give us a call and let's see if you can handle your pain problem today to improve the quality of your life. That's 866-870-5752.
So I'll get back to this question that came in.
Okay.
The person says, I do not have health insurance currently, which is another contributing factor to consider, as I tend to just use alternative therapies. So, look, I'm an alternative doc, but I would never tell anyone to just use alternative therapies. And you need to mix and blend both of them together. There's a lot of things that we can heal using alternative therapies. I mean, that's what this show is all about. What I'm doing is considered by many doctors and people to be alternative therapy. It was alternative back in the day when I started doing it over 20 years ago at UCLA. It's not alternative anymore because there's so many doctors doing it, and there's probably 1 million procedures a day of regenerative medicine being done. I'm making up that number, don't hold me to it. But there are so many doctors who do these procedures now that I can't consider it alternative. My book, which we give out for free if you call the show at 866-870-5752, I'm going to repeat that. 866-870-5752. I'm holding in front of me right now. The people watching the video can see it. It's called Stem Cell and Platelet Therapy. It's got over 250 studies on regenerative medicine. This is not something that is, quote, alternative anymore.
No, it's not.
So if you're going to check out something in medicine that you think is alternative, check out both sides of the fence. Check out traditional medicine, check out alternative therapies, which in most cases are much safer, but decide based on informed consent. Person said, I'm 57 years old, very active, teaching Pilates 5 days a week, and a dancer. So any thoughts or suggestions of advice would be welcome. Yeah, I mean, if you've got an Achilles problem, that's the Achilles tendon, which comes from the calf down to the back of the heel. I treat those all the time, even though people have said that they need surgery, that the surgeon said they need surgery. We heal them very often without the surgery. And even the little tears that they can have, if it's a complete rupture and you can't walk because it's ruptured, then you need to have surgery. I'm sorry. As much as I'm not an advocate of traditional surgeries of the knees and shoulders and neck and back and all of that, if you've got a complete rupture of that tendon, you're going to probably need surgery. Sometimes it can be put in a cast and it'll grow back, but that's something that you do need to check with an orthopedic surgeon before you come to me, just to get informed consent. If I squeeze your calf and your foot doesn't move, I'm going to send you to a surgeon, because that means there's a complete tear. Same thing with any part of the body. If I think I can help you, I will do that. If I think you need a surgical consult, I'm going to set that up for you. I am not against all surgeries. I just want you to know that most surgeries don't need to be done. There's statistics on that in my book.
Indeed, there are, along with 264 scientific studies, actually.
You keep changing the number.
Did I really? Did I make it go up or down?
It doesn't matter. You're pretty accurate, pretty close. So should I take a question while this...
Hold that thought, because it's time for us to take our little halftime break here. You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information coming your way. I'm your host, Nita Valens. We'll be right back.